system. We'll begin by testing the patient's fine and gross motor skills. I'll ask the patient to pat both knees. I'll ask the patient to stop with one hand, and I would do this bilaterally, making sure that the patient can follow instructions and do the motions. Next, I would ask the patient to extend one hand, making sure that she can touch her thumb to each of her fingertips, and I would do this bilaterally as well. Next, I would ask the patient to close her eyes and touch her nose with one finger, doing this bilaterally. Next, to open her eyes, touch her nose with one finger, and to touch my finger. And I would do this in multiple areas, making sure that she could follow the movement appropriately. Next, I would assess the patient's gait. I would ask the patient to stand and walk towards me. I'm assessing whether she can walk in a straight line, whether there are any balance issues. The patient is doing this appropriately. Next, I would ask the patient to extend one foot, touch her toe to the ground, and then her heel to the ground, doing this bilaterally. I would ask the patient to raise her right arm above her head and to put out her left foot. I'm assessing hand and leg coordination. I would ask her to do this bilaterally as well. Next, I would ask the patient to hop in place and to do this on one leg. And I would do this bilaterally, making sure that the patient doesn't have any difficulty hopping in one place or any balance issues. Next, I would ask the patient to conduct a Romberg test. The Romberg test is done by asking the patient to look straight ahead, close her eyes, and maintain the position of balance for 30 seconds. Thank you. Next, we'll be assessing the patient's sensory system, the ability to determine light and sharp touch. I'll be doing this using a reflex hammer, using the sharp end to designate sharp and the rubber end to designate soft. I'll ask the patient to extend both arms, close her eyes, and tell me which arm I'm touching first.
Right. Left. Right.
Doing this in multiple areas. Next, I'll determine the patient's ability to sense sharp and dull. I'll ask the patient to close both eyes.
Dull. Sharp. Dull. Sharp. Dull.
If using one test method fails, I would switch to using the dull portion of a reflex hammer and a paper clip.
Dull. Sharp. 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 Dull.
Assessing for appropriateness. Next, I would test 2-point discrimination. I would do this either on the back of the patient's hand or on the pads of the fingers. The purpose of this is to have the patient tell whether she feels sensation in 1 or 2 points, moving progressively closer until she can feel the sensation only in 1 point. So I'll do this on the back of the hand.
2. 2. 2. 1.
The normal finding in this is to be within 5 to 6 millimeters before the patient can feel the sensation only in one specific area. Next, I would have the patient hold out her hand and close her eyes and identify the number that I'm drawing in her hand.
4. 6.
Yes. Finally, I would ask the patient to identify a common object. I would have the patient close her eyes and hold out her hand. Yes. Next, we'll be moving into a segment of testing the reflexes. We'll start with the bicep reflex. I would have the patient extend her arm loosely at the elbow, place my finger right above the joint, and tap it with a reflex hammer. And I'm assessing the reflex of the brachial area. Next, I would move into the tricep area. I would do this by having the patient extend her arm out to the side, hanging loosely, and I will tap right at or above the joint, assessing the movement down the arm. Next, I would do the brachio radial. I would do this by placing the reflex hammer 2 to 3 inches above the wrist and striking directly, assessing the movement down into the hand. Next, I would do the patellar. I would have the patient move to the edge of the sofa. Allow the foot to hang loosely. Strike just above the patella to observe the foot kick. Next, I'll have the patient lie down. I'll be assessing Achilles, the plantar, the clonus reflexes. I'll have the patient extend one leg off to the side. The Achilles is tested by striking the Achilles tendon, which will cause a reflex through the foot. Next, I will test the Babinski sign, doing a patellar, a plantar reflex. I'll take the end of the reflex hammer and come up the patient's foot. Normal finding in this is that the toes will curl rather than flare out. Okay. Next, I'll assess the patient's abdominal reflexes. Do this by asking the patient to raise her shirt, and I will touch the patient and move out, watching the abdominal muscles contract. Thank you. I'll do the clonus by asking the patient to raise her knee and dorsiflexing the foot, extending, and then quickly dorsiflexing to feel any fasciculations within the muscle. Thank you. Finally, in this segment, we'll be assessing the cranial nerves. We'll begin, several of the cranial nerves have already been assessed, so we'll be beginning with the facial nerve. A portion of this has already been assessed. I'll ask the patient to look straight ahead, to raise her eyebrows, to grimace or frown, show her teeth, and stick out her tongue. I will ask the patient to next push against me on her shoulders, and also against me with each side of her face. I'll ask the patient to stick out her tongue again and say ah. Ah. To swallow. This is testing the hypoglossal. Next, I would ask the patient to turn her head from side to side. And we'll be assessing the patient's musculoskeletal system. If I haven't already done this, I would ask the patient to walk away from me, walking to me to assess the gait. It's already been covered in a prior section. I would ask the patient to extend both hands in front, checking the length of the limb, also the circumference of the limbs. As the patient is walking to and away, I would check the length of the legs, making sure that there's no stumbling or asymmetry in the patient's gait that would warrant further assessment. Next, I would ask the patient to stand, face away from me. I'll assess the patient's cervical spine, asking the patient to lean forward, lean back, and side to side. I will palpate the patient's cervical process, making sure that I can feel the cervical spine and the spaces in between the process. Okay, you can be seated. Next, I would begin a more focused assessment, looking at the hands first. I would palpate the bones and the joints in the fingers, doing this bilaterally, checking the bones in the wrist, checking passive range of motion, and asking the patient to do active range of motion for me. Asking for any pain or any subconscious signals such as facial grimacing. I would continue to work up the arm, doing passive range of motion, feeling at the elbow, doing flexion and extension exercises, asking the patient to do those same exercises actively. Moving into the shoulders, I would flex out and up and down, feeling as the patient's moving. We do the active. Thank you. Again, checking for any pain, crepitus, or any other notifications of discomfort from the patient. Moving into the shoulders, I would ask the patient to shrug the shoulders and relax. To do this against pressure, relax. I would ask the patient to extend both hands, to press against me, and to pull with both hands. I would also, as we move further down into the foot and knee, we'll be repeating these exercises, making sure that the patient can actively do these exercises. To do this, I would ask the patient to lie down, verifying the movement of the hips. I won't demonstrate that. I will demonstrate range of motion on the foot, doing dorsiflexion and extension side to side, feeling in the ankle, into the foot, and the toes, watching the patient for any signs of pain or grimacing or discomfort, feeling for any crepitus as the patient moves and flexes actively. I would also do the knee as well, flexing and extending, feeling the patient's knee, the bony process, as well as the joint, asking the patient